2-year-old male. She's complaining today, chest pain.
All right, welcome back. Today we'll be talking about S-124 for burn patients. Starting off, we'll move the patient to a safe environment and break contact with the causative agent, whether that be a heat environment or chemical. Ensure patent airway, O2 and or ventilate as needed, O2 saturation as needed. Treat other life-threatening injuries and use a carboxyhemoglobin monitor as needed if available. Typically on municipal fire engines, they do have carboxyhemoglobin monitors. Thermal burns. Burns of less than 10% of the body surface area, you stop the burning with non-chilled water or saline. For burns greater than or equal to 10% of the body surface area, cover with a dry dressing and keep warm. Do not allow the patient to become hypothermic. Patients that are victims of burns lose a lot of their heat regulation because their skin is no longer in place to keep the heat in. So now your 98-degree core body temperature is exposed to the ambient air and it's rapidly cooling. For your toxic inhalation patients from carbon monoxide exposure, smoke, gas, etc., move the patient to a safe environment, 100% O2 via mask. Consider transport to a facility with hyperbaric chamber for suspected carbon monoxide poisoning for your unconscious or pregnant patient. Hyperbaric chamber, there's only one civilian hyperbaric chamber in this county, and that is UCSD. There's also one at Balboa Naval. Chemical burns. Brush off dry chemicals, flush with copious amounts of water. For tar burns, cool with water. Transport, do not remove the tar. Note, base hospital contact and transport per S1 or per S-415 will be made to UCSD base hospital for patients meeting the burn center criteria. Burn center criteria, got to know this. Patients with burns involving greater than or equal to 20% partial thickness, greater than or equal to 5% full thickness of body surface area. Suspected respiratory involvement or significant smoke inhalation in a confined space. Injury to the face, hands, feet, or perineum, or any circumferential burns. Electrical injury due to high voltage, which is typically greater than 120 volts. Disposition. Consider hyperbaric chamber for suspected carbon monoxide poisoning in unconscious or pregnant patients. So there you have it, your BLS protocols for your burn patients. So this was S-124, and we'll see you on the next one.